Hello everyone, this is Dr. Sardana from Delhi. I am at RML Hospital and today I'll talk about hand eczema. Now, hand eczema is a very common condition usually seen in OPDs and most of the patients who come to us are usually housewives. It is because of constant exposure to water, products that are used in the hand like sanitizers, and also people who work in certain industries, chemical industries, people who are mechanics, people who work with chemicals, they usually have repetitive exposure that damages the layer on top of the skin, and then later on the allergen that is there in that product goes into the skin and causes hand eczema. Another very common cause of hand eczema is people who got atopic diathesis, means people who got history of asthma, dry skin, or allergic rhinitis. They usually have a sensitive skin causing hand eczema. Now, when the patients come to us, what you actually see is you have cuts in the hand, dry hands, fissured hands, and severe itching. It can involve the whole of the hand, the palm, or the fingertips, or sometimes even the reverse of the hand. Now, the problem with hand eczema, of course, is that usually patients don't come to us initially, they come to us in the end. They try many home measures. And in that particular situation, there are multiple trigger factors. So somebody may be having water, somebody may be having surf and rain as a cause, somebody may be having visual exposure. So the first thing to understand is that the treatment of hand eczema is actually lies with you, with the patients, not with us. Because until unless you avoid contact with that particular chemical or with water or with detergents or with surf and rain or with soaps, it will never go. So you must understand that 70% of the cure lies with you and 30% lies with us. The first step is you must avoid using any particular chemical or exposure to any other salt that causes this eczema. Normally what we do is, because patients tell us that we cannot afford to stop doing work, we recommend certain gloves which are meant to protect your skin from that particular chemical, and that is to be made into a habit. That's number one. Number two is, when you come to us, we normally give you two things. We give you creams, we give you oral medicine. So the creams usually are of two types. One are moisturizers that cause a barrier effect. They prevent your skin from damage to the chemical. And second is, we give topical steroids which are of different potencies with or without an antibiotic to prevent any secondary infection. If that does not work, there are various oral medicine that you give. For a short duration, we do give oral steroids. Then we can go to other agents that prevent the allergic response. And nowadays, of course, we have a new class of drugs called JAK inhibitors that are also used in hand eczema. Advanced therapies we tend to not give, like phototherapy and biologicals, because patients can't afford them and it becomes to be very expensive to them. The most important part of hand eczema is, of course, to have a skincare routine. So after every wet work that you do, you must either use a moisturizer given by us or whatever you have in the house. You must use gloves which are protective to your environment. And of course, avoid any flares. People have flares because of doing work in the house. Some people have got flares due to gardening. And of course, this is a very disabling thing because hands are very important. So one must try to understand that let's not do over-the-counter treatments. Avoid using steroids on your own. They will not help. And of course, in the end, I like to say that you please visit your dermatologist. You should never do self-advice. And there are some very good videos on this particular site which you can see. And if there's any other issue, go to your nearby dermatologist for final advice. Thank you so much.
For more such videos, visit or log into DermaVidya.com.